Every year, millions of older adults experience a stroke, and in those first few minutes, what you do before help arrives can change everything. Imagine this: you're with a loved one, and suddenly their speech slurs or one side of their face droops. Panic sets in, but instead of freezing, you'll know exactly what to do. Today, I'll share a simple, doctor-approved 3-minute trick that could protect your brain and buy precious time while waiting for medical help. This isn't a gimmick, it's practical, life-saving knowledge every senior should know. And before we continue, kindly tap the subscribe button on your screen so you never miss essential health advice that could one day make all the difference for you or someone you love. Hello, my wonderful seniors and caregivers. I'm Dr. Prudence, and this is Senior Food and Wellness, where we focus on keeping you strong, safe, and thriving at every age. My mission here is simple: to empower you with trusted, actionable advice that helps you live longer, feel better, and stay independent. Today's topic is close to my heart because strokes can happen without warning. One moment you're fine, and the next, your body just doesn't respond. I've seen it happen countless times in my medical career, and too often, people don't know how to react in those crucial early minutes. But you don't have to feel helpless. There's a calm, clear set of actions you can take to help stabilize the situation before emergency help even arrives. In this episode, I'll walk you through a short, 3-minute technique that can make a real difference, and it's something anyone can learn. No fancy equipment, no medical training, just your awareness, your presence, and a few simple steps that could protect the brain and preserve quality of life. Stay with me, because by the end of this video, you'll not only feel more prepared, you'll feel more confident knowing you have the power to act when it matters most. When a stroke happens, it usually means blood, carrying oxygen and nutrients, can't reach a portion of the brain. In the vast majority of cases, about 80%, the problem is that a clot or blockage shuts off a brain artery. Without that steady supply of blood, brain cells begin to suffer and die within minutes. This is called ischemia. On the flip side, when a blood vessel bursts, a hemorrhagic stroke, the pressure and the bleeding damage surrounding brain tissue and also interrupt normal blood flow. Once blood flow drops below a critical level in a region of the brain, a cascade of events unfolds. Cells cannot get enough oxygen, they can't clear waste properly, they start to malfunction, and the protective barrier around blood vessels, the blood-brain barrier, begins to fail. The result? Permanent tissue damage if nothing is done quickly. Now, here's how our 3-minute trick comes into play. By acting immediately, you help the brain by giving it the best possible chance while you wait for professional help. When you position the body properly and keep the airway open, you improve the chances that whatever blood can flow will circulate more effectively. You reduce added stress or pressure on vessels, and you avoid further complications such as choking or secondary injury. In other words, you're not fixing the blockage, only the doctors or hospital can do that. You're buying time for the brain, supporting circulation, and helping to stabilize the situation. Research supports the idea that even very early intervention matters. For example, studies show that improving or restoring cerebral blood flow (CBF) early on can reduce the volume of damage in the brain. One U.S. research team at Weill Cornell Medicine found changes in gene behavior in blood vessel cells after stroke, suggesting small vessel repair is a window of opportunity. In short, by staying calm and doing the right thing while waiting, you're giving your brain that better chance to hold on until the professionals take over. Now, let's walk through the exact steps of the 3-minute trick, a calm, simple, doctor-approved method that can make a real difference in those first critical moments after a stroke. I want you to remember this: your goal isn't to fix the stroke, it's to protect the brain and stabilize the person until help arrives. Every second counts, but what you do in those seconds can either add to the damage or buy valuable time. Let's make sure it's the latter. Step 1. Call emergency services immediately. The very first thing you must do before anything else is call emergency services. In the US, that means dialing 911. Even if the symptoms seem to fade, do not wait it out. Many strokes begin mildly and then worsen within minutes. Trained professionals can begin life-saving treatment as soon as they arrive, but they can only do that if you've called. Tell them you suspect a stroke. Describe the symptoms clearly, for example, slurred speech, facial drooping, weakness on one side, confusion, or difficulty seeing. The more information you provide, the faster and more targeted their response can be. This call is the bridge between crisis and care. Make it your first move, not your last. Step 2. Lay the person down on their side, with the head slightly elevated. After calling for help, position the person safely. Gently help them lie down on their side, preferably the side that isn't weak, and raise their head just a little, about the height of one pillow or your hand. This position does two critical things. It helps keep blood flowing more evenly toward the brain, and it prevents aspiration or choking if they vomit or have excess saliva. Avoid laying them flat on their back, because that can make breathing harder and raise pressure inside the skull. If they're struggling, reassure them softly. Your calm presence matters as much as your actions. Many seniors feel frightened or disoriented during a stroke. The sound of a calm, steady voice can lower stress and stabilize blood pressure. Step 3. Loosen tight clothing, especially around the neck and chest. Next, check their clothing. If they're wearing anything tight, a scarf, a button collar, a necktie, or even a snug bra strap, gently loosen it. Do the same for belts or waistbands if they seem restrictive. Here's why this matters. The brain and body need oxygen. Anything that limits breathing or blood flow adds unnecessary strain. Loosening clothing allows for freer chest expansion, easier breathing, and less pressure on the upper body. It's a small gesture, but it can make your loved one feel less panicked and more comfortable while waiting for medical assistance. Step 4. Encourage slow, calm breathing, in through the nose, out through the mouth. If the person is conscious and responsive, help them focus on slow, steady breathing. Guide them gently in through the nose, out through the mouth. The goal here is not to force deep breaths, but to lower anxiety and reduce blood pressure spikes. Stress and panic trigger a surge of adrenaline, which can raise blood pressure and worsen bleeding or swelling in the brain. Your tone and pace set the rhythm, so speak softly, breathe with them, and keep your words short and soothing. Sometimes saying, "You're doing great. Help is coming. Just breathe slowly with me," is enough to bring their heart rate down and their focus back. These steps might sound simple, but in an emergency, simplicity saves lives. You don't need special training or medical equipment, just awareness, calmness, and compassion. Remember, call for help first, lay them safely on their side, loosen anything tight, and help them breathe. These actions won't cure a stroke. Only doctors and hospitals can restore full blood flow, but they can protect the brain and buy crucial time while professionals are on their way. When every minute counts, your calm and knowledge become the most powerful medicine there is. So now you know, a few minutes of clarity and care can mean the difference between life and lasting damage. This is why I'm passionate about teaching seniors and caregivers practical, life-saving habits that truly work in the real world. Keep these steps close to your heart, write them down if you need to, and most importantly, share them with your loved ones. Because when a stroke strikes, knowing what to do isn't just empowering, it's life-saving. Before we move on, let's talk about safety, because even good intentions can go wrong if we're not careful. The 3-minute trick is meant only as a first response guide while waiting for emergency professionals. It's not a cure, and it's never a substitute for medical care. If the person becomes unconscious, stops breathing, or you cannot detect a pulse, do not continue the positioning steps. Immediately begin CPR only if you're trained, and follow the instructions given by the emergency dispatcher on the phone. They will guide you every second of the way until help arrives. Never try to give food, water, or medicine to someone showing stroke symptoms. A stroke often weakens swallowing muscles, and anything placed in the mouth can cause choking or block the airway. Likewise, don't shake the person or try to wake them up forcefully. Gentle reassurance is enough. If you're unsure whether it's truly a stroke, always err on the side of caution. Doctors at the American Stroke Association remind us that time lost is brain lost. Every minute counts. Quick medical treatment, such as clot-busting medications or advanced procedures, is only effective within a few short hours of onset. That's why getting to the hospital fast is critical. Also, avoid changing the person's position repeatedly or trying home remedies you may have heard about. Keep them comfortable, monitor their breathing, and make sure they stay as still and calm as possible. I know emergencies are frightening, but remember, your calmness is a form of care. Use this 3-minute method only to stabilize and protect until professionals take over. The moment trained help walks through that door, your job is done, and you've already given them a stronger chance at recovery. That's the power of being informed, prepared, and compassionate. I know how frightening it can feel when someone you love is in distress. Your heart races, your mind freezes, and you wonder, what can I possibly do? I want you to remember this. You are not powerless. In those moments, your calm presence and quick actions can bring comfort, stability, and even save precious minutes that matter most. You don't need to be a doctor to make a difference. You just need to know what to do and act with compassion. Calling for help right away, positioning your loved ones safely, loosening their clothing, and keeping them calm. These small, steady actions can give them a better chance at recovery. If you're a caregiver, please don't underestimate your role. You are often the first responder in your home, and your readiness can change an outcome. By staying calm, you're giving the person what no medicine can replace: reassurance, safety, and the strength of human connection. So breathe, focus, and remember, preparation is protection. You're not just reacting, you're leading, you're caring, and you're doing exactly what your loved one needs in that critical moment. You're not powerless, you're prepared. Let's take a moment to recap everything we've covered today, because remembering these steps can truly make a difference when every second matters. The 3-minute trick is simple but powerful. Step 1. Call for help immediately. Don't hesitate, don't second guess. Getting emergency responders on the way is the single most important thing you can do. Step 2. Lay the person safely on their side with the head slightly raised. This helps protect the airway and supports better blood flow while reducing the risk of choking. Step 3. Keep calm, loosen any tight clothing, and stay right beside them. Your calm voice and steady presence are the strongest medicine until professionals arrive. That's it, just 3 simple steps. You don't need medical tools or fancy knowledge, just awareness and confidence. These actions may seem small, but they can protect the brain, ease fear, and even save a life. And if you ever find yourself in this situation, remember, you already know what to do. You're prepared, not powerless. If this video helped you, please share it with your family, your friends, and especially with those in your senior community. You never know whose life it might change. And before you go, don't forget to tap the subscribe button, because at Senior Food and Wellness, I share practical, doctor-approved guidance to help you stay healthy, strong, and safe at every stage of life. Together, we're building a community where seniors thrive, where knowledge replaces fear and preparation gives peace of mind. I'm Dr. Prudence, and I want to thank you for taking the time to invest in your health and the health of your loved ones. Remember, one small action today can make a life-saving difference tomorrow. Stay well, stay calm, and stay connected. I'll see you in the next episode. And next week, I'll be sharing 5 foods that help keep your blood vessels healthy and may reduce your risk of stroke. You won't want to miss it, so make sure you're subscribed and notifications are on. This is Senior Food and Wellness, trusted health tips for the golden years, delivered with care.